The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Lerenza Howard, and my preferred pronouns are she, her.
Hi, and I'm Kelly Holmes. My preferred pronouns are also she, her. How are you, Lerenza?
I am doing well. How are you, Kelly?
Good.
I hope your Thanksgiving was great.
It was good. Excited for today's show.
Absolutely. So let's dive right in. Today, we are joined by Rosa Lozano as the Assistant Vice President of Infection Prevention at the Methodist Healthcare System. Rosa mentors a team of hospital infection preventionists, champions comprehensive infection prevention programs, and collaborates with healthcare teams to drive patient and healthcare worker safety. She also serves as the chair of the Emerging Infectious Disease Task Force for APIC, which we will be discussing today. Welcome back, Rosa.
Bienvenidos from San Antonio. I am so thrilled to be here today with you. It is a beautiful, sunny day in San Antonio, Texas. It's 75 degrees, and I can't wait to talk to you about emerging infectious diseases and our wonderful task force.
Oh, I'm so jealous, Rosa. It is about 45 degrees and raining where I am, but I will live vicariously through you. And I have to share that Rosa and I worked together at the beginning of both of our infection prevention careers, and it was just wonderful. And then I moved on to St. Louis, and you moved to Colorado. So it's just really awesome to reconnect with you today. So thank you so much for joining us. And I can't wait to hear all the information that you have about the Emerging Infectious Disease Task Force. Just to kick off, can you tell us a little bit about the program and its inception?
Absolutely. I would absolutely love to talk about our amazing task force. So the Emerging Infectious Disease Task Force, or the EID Task Force, originally started as a group of passionate infection preventionists who came together during the COVID-19 pandemic. And the intention of the group was to help lead our APIC membership during the pandemic as we were all navigating this pandemic together. Once the acuity of the pandemic began to normalize, APIC realized we probably need to continue to have a group of experts and passionate infection preventionists who are staying abreast of any emerging infectious disease, whether novel or whether it's a known agent that might be changing in its epidemiology. That was how the EID task force was born. And several members were picked, and we'll get into some of the makeup of the task force here in just a bit. But that was the original intention, is assistance during the COVID-19 pandemic.
I believe that's so amazing and very much so needed, especially during the time of battling COVID, during the time in which it was a novel infection. So share with us, you noted that there were some passionate IPs that volunteered to partake in this. So describe to us the composition of those passionate IPs.
Absolutely. I am especially proud of how mindful we have been. APIC has been in composing this group of wonderful professionals. So we have about 17 infection preventionists in different capacities, and we represent various backgrounds in healthcare. So we have clinical care, acute care, long-term care. We have public health and academia represented. We have behavioral health, long-term care, a number of consultants that see a wide array of infection prevention practice. And we also have hospital association representation. So it's a great swath of infection prevention and public health backgrounds. We also are widely distributed across the United States. And so we want to make sure that we're capturing information from geography all across the United States. And I'm especially excited that we have 2 newer members, international members. And so now we have representation from around the globe, which is only going to make the products that create in our group stronger. So grateful for those 2 international members to join our team. And the other piece we wanted to make sure that we captured as far as the composition of the task force is folks that are at different stages of their career. And so we do have APIC members, infection preventionists, who are at the early stages of their career within the first 2 to 3 years of infection prevention, all the way to 20 plus years. And so are very experienced infection preventionists too. And again, this helps us create guidance and assistance and products that are able to be understood by a wide swath of infection preventionists. And it also allows representation, whether it's geography, whether it's stages of career, whether it's background. It only makes our committee stronger, and the products that we create are much more inclusive. So really proud of the diversity of this emerging infectious disease task force.
Thank you for sharing that, Rosa. I thank you for saying and making note of the fact that the EID task force is composed of individuals in various stages of their career, right? Because I would imagine if someone earlier in their career as an IP wanted to volunteer, it may seem intimidating to sign up for the emerging infectious disease task force. So that's a great note that even if you're earlier in your career, this is a great opportunity for you to learn and to be able to take this knowledge back to your facility.
I love that too. I was visiting the resource on the APIC website, and I noticed that you guys already have 8, is that correct? Playbooks for everyone to access. And I think that's amazing because it's been 3 years really since COVID-19. So y'all have been extremely busy pulling all of the different information together, and then obviously keeping your pulse on what's in the news and what's emerging around the country. I think it's really fantastic that you've incorporated that global perspective as well, because we know now that the world is becoming a smaller place, we can just catch an airplane and share our love and share our germs. The difference between the APIC committees and an APIC task force. Tell us a little bit about that and how you became involved.
Absolutely. The beauty of the task force is, and the reason we're using the term task force rather than committee, is that a task force under APIC is appointed by the president of APIC. And so what this means is there's a certain level of flexibility that's granted from a task force perspective. So recruiting looks like being able to pick different experts from around the United States. We're evaluating how we enlist new members of our task force because we want to make sure that we're equitable. We want to make sure that we continue to maintain that amazing level of diversity that we have today. But it also means that we've got flexibility within term limits. And any of our infection preventionists who are part of our task force who want to continue to serve are able to serve as long as they would like. But as our task force members may cycle through or cycle out of the task force, we're able to bring more members in at any time. And so that's one of the nicest aspects, just that flexibility piece, especially with a topic as dynamic as emerging infectious disease. It's nice to have that flexibility to continue continuity into the task force. And so how did I get involved, or how did I become a member of our EID task force? So first, I think it's important to note that I have absolutely loved infectious diseases since I was a little kid. I was about, I think, 10 or 11 years old when the movie Outbreak came out. And
that was mine too. You're speaking my language.
Yes. Yep. Especially Renee Russo, who played a lead scientist, to see a female that was leading this basically Ebola gone airborne outbreak in the United States. It was absolutely incredible to watch as a kid. And I still remember how I felt sitting 6 inches from the television screen, just in awe of what I was seeing. And so I was so inspired by that movie. And a few years later, my parents bought me my first microscope at home. And I was just fascinated. I wanted to look at everything under the microscope. I wanted to see all of it. And so I would ask my dad for different samples. Dad, can you pick that scab off so I can look at it under the microscope? Hey, Dad, can I sample hair so I can see that? And he drew the line at when I asked him for his urine.
Oh like, gosh, Rosa.
Absolutely not. That's not happening. You need to go. Let me introduce you to a pond. I'm sure pond water is going to look great under that. So, very supportive of my interest in microbiology and in infectious disease. So segue into as I began my undergraduate career, I had a mentor who's a pathologist who took me under his wing in Austin, Texas. And I also had an incredible professor. She's a microbiology professor at the time at UT Austin. And the two of them introduced me to public health. I thought I wanted to be a pathologist and go the medical school route, but all of my questions to them were around prevention. I really had a strong interest in, okay, I understand this disease process, but how did it go so far? How did we get there? Could we have prevented it from ever happening? And then the rest is history. I've been an infection preventionist for 16 years. I've absolutely loved my career. So fast forward into APIC membership. I cannot stress enough how important it is to get involved in a professional organization, whether it's APIC, whether it's something different, if you're in another field altogether. APIC membership and participation in local chapters. So shout out to the Central Texas chapter, Houston chapter, the Mile High chapter, in Denver, Virginia chapter, and now San Antonio, all local chapters I've been able to participate in. So whether it's local chapters or national committees, it's incredible experience not only to grow leadership, but also to expand your network of amazing professionals that you will come in contact with and that you can call on anytime you need help or assistance. And so it's just been absolutely incredible experience. And from an APIC standpoint, I started out in the public policy committee, loved my experience, parlayed to the communications committee. And it was while I was on the communications committee that I was tapped to represent the communications committee to the newly revamped Emerging Infectious Disease Task Force. And during my time as a representative representing the Communications Committee, you can probably tell by now I'm not very shy or bashful. And so I was very vocal about some ideas I had for the EID task force and some visions that I had. And through that vocalness, a few weeks later, then President Linda Dickey and President-elect at the time, Pat Jackson, asked if I would lead the task force. And I was absolutely thrilled to do so. That's how I became involved with the task force. But I think it's important to note just the importance of active involvement in APIC and how rewarding it can be and the types of opportunities that it leads to.
Rosa, thank you for sharing that, because I'm a big proponent on being actively involved within whatever professional organization, but specifically for APIC, really honing in and building those relationships, seeing where you fit in, test out some of the committees to see where your interests lie. It is a great opportunity to, like you noted, to build those relationships that are cross-translational within your career. One of the ways in which you all started off the episode was that you and Kelly have a connection. prevention. And even that's one of the things that I learned about our profession. Although ever so big, we are very small. You never know how your paths may cross with the individuals in which you're engaging. So I think it's very important to get yourself plugged in as an IP or someone who desires to be an IP, become a member of APIC, ascertain what offerings they have as far as committees and task force. And it's a great opportunity for not only for you to learn, but for you to sharpen those skills that are needed in order to actualize the competency model, APIC's competency model for infection preventionists. So that was very great. And I know that you noted mentorship as well, which is a huge component in being successful, I believe, as an infection preventionist. But segue into the playbook. Kelly briefly noted the amazing playbooks that were curated by the EID task force. And of course, that we have the CRS playbook, Mpox, measles. And as we know, measles has resurged within the United States. So very important. And these playbooks are very informative. So share with us, Rosa, what was the idea behind its inception, the playbook's inception?
I'm so happy to share that story because I think, again, it shows the benefit of active involvement in a professional organization. So during the time that the EID task force was kicking off and honoring the history of the task force starting out with leading through the COVID-19 pandemic, I remember I still felt a great deal of frustration at the way that guidance unfolded during the pandemic. So let me first say, I acknowledge 100% everyone was doing the best that they could. All of our professional organizations, federal partners, local partners, everyone was doing the absolute best they could. And the science was changing and evolving. And it was a very dynamic situation. So I 100% acknowledge that. Even with that acknowledgement, to understand that an infection preventionist or a healthcare leader or a public health leader, community leaders who are having to respond in the moment, not only to the dynamic science of a global pandemic, but to the dynamic emotions of the people that we serve, it was exhausting to navigate lengthy scientific guidelines and then trying to digest and translate all of the different guidelines and things that you're hearing from different sources into actionable work that we could do to prevent transmission of COVID-19 and to protect not only our patients, but ourselves and our care workers, to protect our communities from COVID-19. So all of this kind of exhaustion, frustration, I was still carrying with me, and I very much wanted to do something about it. So as I was talking about this frustration to the task force, it really resonated with the members of the task force. And so it translated itself into action. Okay, so what can we do? How can we make things better? How can we make things more easily understood by infection preventionists or public health? And so that's where the idea for the playbook was born. Can we create a document that is comprehensive so that we're pulling from several different sources into one single document, which means the infection preventionist who's having to respond in the heat of the moment doesn't have to go search this place and search that place and read here and read there. It's a one-stop shop. And can we make it very succinct so that it's easily understood? If I need to answer this question right now, how do we test for this agent? I can go straight to the spot. Here's how I test for it, and I can move on. I don't have to flip through pages and pages of documents or research. And the other piece, and my personal favorite spin to it, is the guidance actionable. The science and the theory, those things are very important, and we've included lots of references in the playbook so that at any time a user of the playbook can go in and read the science and the theory if they would like to. But if they just need to understand how to respond, they just need to understand, what do I do? What specific actions do I need to take? That information is provided to the playbook user, and it's actionable, it's easily understood. the infection preventionists can take that information and run with it. So this evolved through several conversations with the task force, but the idea really resonated with the team and they were so excited to get started with work. So we built the plane as we were flying it. As we picked our very first playbook, and that was the polio playbook. At the time, polio was being detected in wastewater in New York City, and there was a case of polio that was causing some concern. And so we thought, let's start with polio and let's figure out how we develop this thing. We'll figure it out as we go along, but at least we can get started, get some things on paper and start to develop our structure. And now we have several playbooks that are beneficial to our communities. The other piece I think is important to mention is that the playbooks are free. And so we felt if our community benefits from having access to resources, as infection preventionists, we all benefit. As healthcare, we benefit as well. So let's have these resources be free and easily accessible to the public. They're also Word documents, and so they can be tailored to any environment. So whether it's acute care, behavioral health, I've heard some schools were taking a look at these playbooks, correctional facilities were taking a look at these playbooks. Anyone can personalize these playbooks, and so that they're, again, succinct, operational, and easy to use for any of our leaders who are navigating any sort of infectious disease emergency.
That's fantastic, Rosa. I relate so much when you were talking about the early days of COVID-19. And for me, I think that was March of 2020, that week where it just hit so hard. And the guidance was changing more than once a day. And so we would read what we needed to read, and then we would run and share that and literally run to the ED or to the ICU or to engineering. And then we'd come back to the office, get some kind of update, and then run again. So that was stressful. I think we all just did our best and got through it. And then always saying to everybody, thank you for your patience as the guidance is updated, and we will relay the information as it becomes available to us. So putting that all in one place for an infection preventionist is so valuable, because really that first phone call, it's okay, here's what we have. What do we do? So really we want to triage, we want to isolate, and then go from there. Like, how can we contain this really fast and in the correct way? And then let's catch our breath and figure out what we need to do. So I think that is extremely helpful. Then, so you were I think that would be very challenging though, as a playbook author, because the guidance is changing rapidly with something like COVID-19, less rapidly with something like measles. Obviously, it's an evolving situation that can hit very fast, but we do know the science behind measles, how to prevent, how to isolate. But as a task force, how do you all manage that changing information and then updating those playbooks?
It's a wonderful question, and it's a topic that generates lots of discussion within the task force. So we have been blessed, I'm going to knock on wood, we have been blessed that the agents we have written playbooks for are agents that are well known and agents that there's lots of research and guidance around already. So we've gotten to practice several times by writing playbooks on what's known. We have not yet practiced on agents that are unknown. So there's going to be two lanes of work. For those agents that there's already lots of science, lots of guidance around, our process is going to be to take a look at the playbooks at least every 6 months, or as soon as there's a major change to the science, but at a minimum every 6 months, just to make sure that everything still makes sense, the science still checks out, and the guidance is sound. And so that's probably going to be the typical workflow. For a new and evolving agent, what we have developed is a nimble quick response group. It's our emergency response group. So there's a smaller subsection of the EID task force that has volunteered that at any time will come together and be able to address any novel agent or any known agent that has gone substantial changes and that needs a rapid response. And so for that situation, that nimble group would come together, develop the initial draft of the playbook, and then would set the time frame for updates. So a couple of things. I think it's really really important to note that our playbooks are going to be dated so that we understand the date and when there might be resources that are needed. But we both connected in our frustration with the ever-changing guidance. And so there's also that piece of how often should we update this guidance? What is operational? What makes sense? And when we're putting together the guidance and reading the science, are there themes that we can really stress to help folks keep messages sustainable, to keep messages consistent? So we're not changing. In other words, we're not changing back and forth between droplet, airborne, droplet, airborne. If there's a sense of airborne precautions that are needed, let's just stick with airborne until we are positive that we're going to drop down to droplet so that we can help folks keep messages consistent and succinct and not have this flip-flop back and forth. And so that's part of the beauty and the dynamics of bringing together a diverse team of individuals to come together and help develop this guidance that is so dynamic, that it's ever changing at the benefit or for the benefit of our communities and our APIC membership, taking all of these things into consideration. And so I think it's important to understand that there's two different workflows in playbook updating and what's the word I'm looking, revisions. So revising the playbook and updating the playbook. But there's also going to be a completely different book of work should we have a novel agent that we need to address, and how blessed we are to have quick response members of our task force who will lead that effort.
I agree. I think that it is a very important distinction to have the two different lanes, like you said, because those novel pathogens will always be throwing us for a loop until we know more science behind how it spreads and the makeup of it. Having an organization like APIC and leadership like you, knowing that you guys have our back and that you are running behind the scenes and updating things as they become available is such a soothing feeling. It takes the weight off of your shoulders a little bit. So I really appreciate that work that you all do.
Kelly, you reminded me, you're absolutely right. We are so blessed to have this incredible group. I was remiss in in failing to mention our APIC staff who are on our emerging infectious disease task force. They're absolutely incredible. They keep us moving. They help us with so many logistics. They do so many things to support our task force that allow us to continue to be very efficient. I can't speak highly enough of the APIC staff who are on our task force and the resources they provide and the organizational structure that they provide. It just makes our job as EID task members so much easier. So thank you for reminding me to make sure to include that.
Yes, I think that is a very important point to make because I'm not sure a lot of organizations have the network that we do. And when you go through something as horrible as a pandemic, having someone that has your back or having an organization that has your back, because we all find that burnout, right? So those people on the task force and the people behind the scenes that continue to work with it daily and then stay up late at night so that they can help us and help others with these types of documents is just an incredible gift. So grateful for it.
I absolutely join in those sentiments of really being appreciative of you highlighting the work that is being done behind the scenes. It sounds as though it's an iterative process in developing the playbooks and continuing on to ensure that they are up to date, entails best practice. But one thing to note is that, of course, you've made note of the importance of diversity and equitability in the structure of the EID task force and the development of the playbooks. And as we all may know, health equity is absolutely integral in all aspects of healthcare, especially as it pertains to infection prevention. So it's absolutely important that when developing playbooks, we're also evaluating whether or not this may present some barriers to facilities and organizations. And based on what you've explained, it's absolutely important to have a diverse team to work on initiatives, to garner those differing insights and information regarding how different facilities may be impacted in a way. So saying that to say, some facilities may lack the resources necessary in order to appropriately institute mitigating strategies to even a novel emerging infection or other infectious diseases that are well known to us. Share with listeners, how can healthcare organizations that may lack those resources utilize the playbooks effectively? I know that you noted it is free, and it is in a Word document, so they can easily edit it. But share with us those insights.
Absolutely. And I think this is a wonderful opportunity to be transparent about some of the conversations that we have within our task force and the learning in the spirit of diversity and equitable access to resources. Some of the discussions that we have and the learnings for us around what's needed in our communities. As far as easy access and access to resource, I think it's important, at least it was for me in my learning, it's important to understand that originally the task force members were all in the United States, which for the most part has wide access to resources. And so as we were developing the playbooks and as we're developing our products and our guidance, we really only looked from that lens. And it wasn't until our two international members joined the task force that we understood we need to broaden our lens and the way that we view these playbooks and access to the playbooks. I think I bucket it into two buckets. There's areas or healthcare facilities in the United States that have limited access to resources that we certainly need to address and ensure that they have access to the playbooks. And so we've talked about how do we socialize within APIC is great. We've got our APIC membership and the various communications, which is wonderful. But there's been a big push to socialize through social media as well, so that we're hitting other audiences that maybe aren't specific to infection prevention. But I think we still have a lot of opportunity to make sure that, especially for communities who have limited access to resources within the United States, they understand that this is available to them and it's meant to serve these areas as well. So I think that's important to point out. The other is from an international standpoint. And again, in the spirit of transparency, when we as a task force were talking about what the international community needs, what the global community needs, we have to keep in mind that just because we have an international audience doesn't mean that they lack resources. There are several international audiences that have access to several resources and that can respond. And there are some as well communities who have very little to no access to resources and just the spectrum that covers. And so that applies to the United States as well. And so we have this assumption that in the United States, all of us have access to all the resources that we could possibly need. And that's not necessarily an accurate assumption. From an international standpoint, we have several spectrum of healthcare facilities, some that have great access to resources and some that have very little. So we need to write our playbooks from a standpoint of accommodating the spectrum of different facilities who could be using the playbooks. So it's been a wonderful learning conversation. We've learned from our international members, internationally speaking, teams use the World Health Organization as their primary place for guidance, but they do look at the CDC and they do use CDC guidance as well when they're developing their own guidance. And so including World Health Organization and more global guidance, we're going to start to feature an international section within our playbooks. So we've got some playbooks who are due for their 6 months of review. During those 6 month review, we're going to include an international section to address guidance specific to global input, as well as start to look at what does it mean for resource restricted areas. What are some resources that they may have or areas that they may be able to go to for assistance and guidance and in resources? And so I think it's been a wonderful conversation. I think it aligns really nicely with our drive within APIC to ensure diversity and equity in our products and the way that we serve our membership. And so definitely still a learning conversation. And I think the beauty of the playbooks too is that they're open for feedback. And so we would love to receive more feedback as well, international members, local members, to be able to continue to grow our playbooks so that they serve a wide audience. Because again, our communities are stronger when we all can respond to emerging infectious disease with a strong response in the protection of our communities.
Thank you for sharing that, Rosa. And you touched on a very important point, because as we going through the COVID-19 pandemic, we all know the implications of global health. And it's absolutely integral and important, I think, as a task force to develop that global health lens to ensure that we are developing the appropriate playbooks and resources needed. So does access to the playbooks and other EID task force resources require an APIC membership?
So access to the playbooks and the EID task force information does not require an APIC membership. And so that was the piece around, and we want to make sure these resources are free. Free meaning there's no paywall that these resources are behind. Anyone can access these resources. You don't have to have an APIC login, membership login in order to access the resources. And so anyone can download these documents in a Word format and be able to tailor them for their organization, which again was very important for the task force. And I'm so grateful that our APIC leaders saw the need and supported us in that request so that all of our communities can benefit whether or not they carry an APIC membership. But with that, I think it's also important to socialize the amazing resources that APIC provides. Some of them do require logins, and so we may reference the APIC text, for instance, and so that will require membership and access to APIC text. And so we do reference those resources as well, because it's important for everyone to know what's out there and what's available. But from the playbook standpoint and the content within the playbook, those are completely free and they're open to the community. And so anyone has access that can pull up an APIC website and is able to utilize those resources.
I love what you mentioned about the wide versus the focused topics that the EID has picked. And again, we mentioned that really the EID task force is in its infant stages of development. And the amount of work that you all have put out already is really incredible. But I think it's really proactive that one of the first things that you did pick was the IP response during a humanitarian crisis. And I think that is applicable globally. But as we know, with global warming and crazy weather, things happen. And I remember Hurricane Katrina, and I was living in Houston at the time, and we had an influx of people from New Orleans at the Astrodome, and that is where they were sheltering. And so a playbook like this for that type of humanitarian crisis is gold, solid gold. I really appreciate that proactive approach that you all are putting into this. And we know that the bacteria and the viruses don't have borders. Involving that global perspective is so helpful.
So I'm also excited to know what are some future outlooks for the task force? What are some new initiatives and or resources that we can expect?
Absolutely. This is such a fun question to answer. So I've alluded to some things already sprinkled throughout our conversation today. I'm really excited to have our international members and featuring an international section of our playbooks, for instance. So that's going to be something that's new and unfolding in 2024. And then I also mentioned we're looking at building our structure. And so as a task force, I think the spirit of responding to emerging infectious diseases is that you fly by the seat of your pants and you just go and you do. And so that's what we've been doing for the last year and a half. And we've just been going and we've just been doing. But we have a very thoughtful member who said, hold up. Do we have an opportunity to build some structure? Do we have an opportunity to define our scope of work? And as she's talking to me, I'm thinking, yes, this is why I love our task force, because we have different members that are so strong in different areas. And her bringing this up, that resonated with our task force. So we decided to pump the brakes a bit and develop our structure. So that's what we're doing right now. And as we're developing our structure, we were all going back and forth. Well, where do we start? How do we define our scope? How do we decide what we're going to work on and what we're going to prioritize? And we had another different member, actually one of our international members, suggest, why don't we use a risk assessment? It's what we do in our infection prevention program planning. It makes sense to do here. And all of us face palmed and thought, well, yeah, we need to use a risk assessment. Of course we do. It's such a basic task from an infection prevention standpoint, but yet we make things so complex and forget about those basic structural components that help solidify our work. And we're in the midst of our risk assessment right now. And so delineating our priorities. And so we've got several different buckets of priorities. We've got agent priorities. And so which viral and bacterial infections do we want to prioritize and address, whether it's playbooks or socializing guidance in 2024. We also are continuing along the conversation of humanitarian crises, IP response in shelters, different emergency management type of conversations, which then parlayed us into a larger conversation of emerging infectious disease is, I've already talked about slices of pie. I might be hungry, but I'm going to go back to that analogy. Emerging infectious disease is a slice of the overall emergency management pie. And do we have an opportunity to look at different emergencies and maybe broaden the scope of the emerging infectious disease task force to take into account all of the different emergencies that infection preventionists and public health leaders respond to, and who our membership and our communities may benefit from playbook-like products or different guidance that we can develop. So when we talk about bioterrorism, for instance, it's in this gray area between infectious disease and emergency response. When we talk about climate change and all of the different dynamic emergencies that our infection preventionists will be have been navigating, it's important to note we may have the opportunity to have a more global perspective. So that's a conversation point right now that's been a fascinating conversation point, one that the task force is really excited about taking a look at. We may need to broaden our scope in order to benefit not only our APIC membership, but our community. So no shortage of great plans. I think what you'll hear in 2024, there's going to be some new agents. There's going to be more information around taking a look at bioterrorism. There's going to be more kind of that crisis response, some of those products that we want to include as well. And then just the bringing in the international view and being able to serve our international audience are going to be some new aspects of what we're going to prioritize and what we're going to operationalize in 2024. So I'm so excited for this upcoming year. There's so much to do, and we have the most amazing group of infection preventionists and experts to pull it off.
These are some amazing initiatives, and I'm sure listeners are excited to see some of these things come to fruition. So thank you for sharing that.
Rosa, I'm so glad that when Lerenza asked you that question that you weren't like, oh yes, we are running around like crazy with a flesh-eating pandemic bacteria. So let's just take a breath and be grateful that we are in this moment in between that extensive thing that we all just lived through known as COVID-19 and the next one, because we know there will most likely be another one in our lifetime, but hopefully now we'll be more prepared for it. COVID did not give us a lot of good things, but I think the EID task force is one of those things that is really awesome that came out of this. So I am very grateful for the work that you do. And it's been great picking your brain about this. In closing, we ask our guests a question every single time. So today, your question is, what is something that you wish you were told at the beginning of your IP career?
Thank you so much for this question. And Kelly, yes, I have such fond memories of you and my initial mentors in infection prevention as I started my career. So I want to say collectively, my sister mentors, as I was very early in my infection prevention career, you did tell me this. I just needed to practice better listening. Mm-hmm. But something that I wish I really would have honed in on is how important it is to grow your network. And mm-hmm. so you supported, and my first infection prevention sisters supported me in joining APIC, in getting started and volunteering within my professional organization. But I just cannot stress enough how important it is to grow your professional network. It's important for us to, as infection preventionists, our roles are so dynamic. And with those dynamics can come a certain level of pressure or a certain level of stress. And it's amazing to have a brotherhood and sisterhood of infection preventionists that I can call at any time and say, OMG, listen to what happened today. And you have a kindred spirit to share stories with. You can also go to these individuals in not only in your moments of need, but in your moments of celebration. My first promotion, it was infection preventionists that I called and wanted to share those experiences with. And then as well, Lerenza, I think you mentioned it's a very small world in infection mm-hmm. prevention, and healthcare in and of itself is a very small world. So I've been all over the place. I've been in Texas, Colorado, Virginia, and now back to Texas. And there are so many people I have crossed paths with multiple times in my journey. And so also from a career opportunity standpoint, is it so important to network with others and build relationships with others, because you just never know. You could be working together, whether on a project or whether from a career standpoint, you could be working together in the future. So important to remember to develop networks, put yourself out there, introduce yourself to people, share your stories. I think one of my strengths is that I love to be transparent and genuine. And there's usually someone who picks up on that and says, oh my gosh, that happened to me too. Let me tell you. And then from there, it's a beautiful friendship. Can't stress enough the importance of networking and relationship building.
Thank you for sharing that, Rosa. I agree. I think later in my career, I really realized the importance of that network. And really, that's the way out of burnout for me, mm-hmm. is this network of all of you and the support that you give, and someone who really understands what it is like on the front line, the day-to-day. And then I really appreciate the work that you do, because I know that you manage not only a system, but people's emotions as well. And then you go home and you work on stuff like the emerging infectious disease task force playbooks for all of us to use. So I see you, I hear you, and I appreciate you.
Yes.
Thank you. Thank you.
Thank you, Rosa. Thank you for your time. It's been a great discussion. Until next time.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.